Tim Bennett here from the Cortland Voice, and I'm here with Dr. John Powell from Cayuga Health. Doctor, how are you today?
I'm well, thanks. Thanks for having me.
For sure. Um, Today we're going to educate the community on lung cancer awareness because it's November, and that's one of the health awareness month topics, lung cancer awareness. But before we kick into that, Doctor, I want the community to, the greater Cortland County community to know about you. So, Dr. Powell, tell us about yourself.
Yeah, thank you very much. My
Mhm.
name's John Powell. I'm a radiation oncologist. I work at Cayuga Medical Center in Ithaca, New York, about this last decade. I grew up in Syracuse, New York, so I'm a native upstate New Yorker. Went to college in Ithaca a long time ago. Like many people, tried to escape the winter and moved down to North Carolina for just a minute. And I've been back here about 10 years practicing radiation. And one of the diseases that I see commonly in my practice and one of the biggest challenges in oncology is managing lung cancer. So anytime there's opportunity to shine a light on this disease and the advances and also the opportunities to improve the outcome of my patients who have lung cancer, really appreciate the opportunity to be here.
Well, I thank you for taking the time for it. And I want to say this too. This topic actually hits home for me because my own mother passed away from lung cancer in 2014, stage four. And any opportunity that I have to educate the community or help them be aware of it, I want to do. And when I
Okay.
spoke with some administrators at Cayuga Health, and I brought to them my wanting or my feeling of needing to put it out there. They were more than willing to connect me with you, so I thank you for this. But just to give a clearer breakdown for those that might not understand what lung cancer is, what would the scientific definition of that be?
Yeah, so there are a couple of different types of lung cancer. We name cancers or define them based on the organ in the body that they start in and the type of cell that develops into cancer. So there are a couple of different types of lung cancer, but unfortunately, it's a common disease. And unfortunately, it's an extremely deadly disease. It's the second most common type of cancer in men and women, and the leading cause of cancer death across the United States. Estimated over 120,000 deaths will be attributed to lung cancer in 2023. And one of the things that's unusual about this, unlike many cancers, the majority statistically are driven by a single risk factor. So it gives us a unique opportunity to work on tobacco cessation and to work on prevention. But also the reality is that 70 years of smoking history in the United States is catching up with us, and there's a grand scale of medical work being done to try to deal with folks who already have this risk factor in terms of screening and improvement in terms of the management of the disease after it's diagnosed.
Now you said factor. That's a key word to me. So tell me about those symptoms or those risk factors. Like break that down. I know they're two different things, but break that down for me.
Absolutely. So 90% of lung cancer diagnoses are directly associated with cigarette smoking, with tobacco. We don't have as much research on vaping, for example, but I think there's good reasons to be concerned that cancer risk is associated with inhaling nicotine in various forms. The strongest one is cigarette smoking. And I'm glad to say I grew up in the era, I was in a house full of smokers. Tobacco cessation became part of culture around the time that I was growing up. I remember 1998 was the tobacco settlement and the awareness of what information had been available about the health risks of tobacco for a long period of time. At the same time, the best movies I saw growing up, all the cool people were smoking. The culture was pro smoking when I was young. And by the time I'm into my 20s, there's a general improving awareness of the risks associated with it that I could see. Goes back even to the Surgeon General's warning in the 60s, but we didn't see the number of smokers dropping nearly as much early on, say 70s, 80s, 90s, as we have recently. So I'm glad to say that statistics are a little variable, but ranging from, say, when the folks came back from World War II, around 50% of adults were smokers. These days, I could find numbers as low as 10% approximately who are smokers. And so that's a reason to believe that lung cancer is going to become much less of a problem. The age-adjusted incidence is going down a lot. On the other hand, there are huge numbers of people currently affected by this year after year. And because the risk factor takes years to build up, it's not going to change quickly. So not just prevention, not just smoking cessation, but also early detection and screening. One of the hardest things about lung cancer management, medically speaking, is that a lot of my patients are not symptomatic when they start to develop cancer. Some cancers, people get a symptom early on, and it can be detected at an early stage when treatments are most effective. In lung cancer, historically, most diagnoses occur when someone has symptoms, often due to stage 3 and stage 4 disease, when the disease is most difficult to treat with success. And so that's why lung cancer screening is a really, really important aspect of advocating to improve the outcomes of people with lung cancer.
I mean, you're spot on. Like I keep bringing it back to my own mother because that's what I know, but we didn't find out to stage 4.
Yeah, it makes
Legit.
it
She, she
really
had
hard.
she had a cough. That's it. Just a regular cough, a hard cough, but a regular cough. She didn't have that forever, just for a couple of months. And in theory, that would have been a telltale sign. But if you have a hard cough and it's February, March, it's also the changing of the seasons. So you don't know, oh, it's a cough I haven't been able to kick, or but that's why it is good to see your primary care physician, or making sure people stop by Cayuga Health. But what other symptoms might there be, just like specific on symptoms, just like bullet points?
Yeah, so I think you hit right on the head, the cough, the shortness of breath,
Mhm.
um, difficulties with overall health, weakness, fatigue. Sometimes weight loss will be a sign that that cough isn't just the normal kind of seasonal cough the person has. But I think you're right that a lot of people, they're kind of used to these type of symptoms at some low level, and they don't immediately identify that there's a change that could mean something serious. I would say more severe symptoms, advanced disease can cause a lot of pain and fairly significant debility, but that's often after the disease is present for a significant period of time. So at the early stages, symptoms are often fairly mild when most people wouldn't really know to go out and seek special care, which is why we work on folks who have the risk factor, so age 50 to 80, more than a 20 pack year smoking history, so that'd be a pack a day for 20 full years, or 2 packs a day for 10 years, having current smokers or folks who've quit within 15 years. All those folks are eligible now for lung cancer screening, which is the most effective way we have to detect lung cancer early when the best treatment options are there. So hopefully, and we have seen this program started at Cayuga Health about 12 years ago, and we've seen consistent increases in the number of early stage cancers detected through screening. So we're really, trying to champion that, trying to reach out, because it turns out that there's a little bit of a difference between lung cancer, I think, and other cancers where there's a lot of knowledge and advocacy. Lung cancer often affects people, in my experience, who are not directly accessing healthcare regularly. We know there's huge difficulties with health disparities in lung cancer, as in many cancers. And so I think needing to reach beyond just the folks who are already established with primary care. And that's why I really appreciate the opportunity to speak to your audience today, so that people who might not be accessing care, but fall into the category of risk for lung cancer, might be motivated to find out what can be done, because there's a very large research study done on lung cancer screening around 2011 that proved that that process of getting an annual low-dose CT scan reduces lung cancer mortality by 20% for that group of people. So that's a big push for me, and I really appreciate the opportunity to talk about that today, because I think that that's a big part of what we're going to do to help people who already have those risk factors.
Now, when someone meets with their primary care physician, um, is it brought up to them to possibly, okay, so I already saw the head nod, beautiful, that's a beautiful thing that you already they do advocate for that. I mean, I know at Cayuga Health you have basically everything, but like almost every type of service, you know.
I
But
hope I hope so. I do think that primary care is really complicated. They have many jobs, people have several illnesses, and of course they're going to document and ask about smoking history. I have a challenge in dealing with tobacco cessation in that I meet a lot of people who are carrying a new diagnosis of lung cancer, and to jump right in and start talking about cigarettes, which were the cause of that disease, makes me feel like we're blaming that person in some way. And there's been a lot of history around lung cancer that maybe the advocacy, maybe the resources and the support aren't there because it's a human behavior that can frequently lead to this disease. And I think there's some associated stigma. You know, people are kind of blaming themselves. Most of my patients who are active smokers working to quit are much harsher critics of themselves than I am of them. But I do think it complicates the conversation. And I think that, you know, for people who are motivated, going out of your way to make a visit with the primary care specifically to talk about lung cancer risk and find out if screening is right for them is worthwhile if it's not getting picked up in that busy conversation about all of the elements of health. So I think people need to advocate for themselves. It's a pretty new screening test. It's not like mammography or colonoscopy, where all of the primary care physicians have been recommending this for their whole careers. It's only about a 10 or 12 year interval where we've really had good data for screening. So it is kind of a newer screening process, and I don't think everyone's getting picked up that for that reason.
Okay. Um, what final comment would you like to make to the community?
Well, I'd like to implore people to work on smoking cessation. I think that it has a lot to do with young people. You know, there's many people who have already been smokers, and creating a culture where smoking is not cool, where it's recognized as another addiction problem and people are provided help for that addiction. Consider smoking cessation and support everyone in your community that's affected by lung cancer, because unfortunately it's way too common and many people have lost loved ones to these diseases, and it's really just a terribly hard thing to watch. We work on it. We're trying to improve healthcare, immune therapy, more targeted radiation, improvements of treatments, but there's still a great deal of suffering. And so I really applaud you for taking some time and your own voice to raise awareness for the population and get everybody out there to get them screened.
Yeah, I mean, I really care about this because to be honest with you, I mean, when I'll say I was a mama's boy, you know, and she meant everything to me, and I personally do not want to see anyone else feel the pain that I felt through not knowing about, you know, a lung cancer screening or something along those sorts, or knowing what symptoms to look for. But through my pain, I become an advocate, and I try to raise awareness, and I pray that no one ever has to feel that. And if I can help one family, I've made a difference. So I thank you again for your time, Dr. Powell. I thank everyone over with your Cayuga Health staff. And once again, this is Tim Bennett, Cortland Voice, and thank you. God bless.